And welcome back. It is 6:45 here on the Tuesday. We have our friend Dr. Rob with us this morning. It's always great to have him.
Thank you.
Thanks for being here.
Thank you.
We're talking about something that's really important today. A lot of people probably will find themselves in this position where they have cats that are getting older.
Yeah.
And there's a lot that goes into taking care of an older cat.
There is. And I think it's the same type of things that we worry about for ourselves in a lot of ways. We need to make sure they have adequate diet. Maybe they're a little overweight, maybe they're a little underweight, and there's changes that need to be taking place in there. So make sure you're discussing that with your veterinarian.
Okay. Yeah, I was asking you earlier, what do we consider an older cat? An elderly, a senior cat, maybe?
Yeah, we're usually talking about 10 or 11 years old, and then we consider them a senior. They age phenomenally fast. Even like at 6 months, we consider them 10 years old.
That's crazy.
Yeah, it's crazy. Faster than dogs.
Much faster than dogs. But the crazy thing to me is it seems like cats live longer.
Exactly. So they exponentially increase their age, but then they hold that older age much longer than probably the rest of us in a lot of ways. So.
Okay, what are some of those things that we need to look for? And I say this because I have a cat at home. He's older now, according to that. And the one thing that I found deteriorate really fast with his health was his teeth.
Yes. And exactly right. It's very nice to have your veterinarian involved in that, because looking at those teeth is paramount for keeping these cats healthy. A lot of them start having health or teeth issues very, very early in life. And cats have very unique issues that dogs and people don't even get. So a lesion that we call a cervical neck lesion, it's right at the edge of the gum line. Very, very painful for these kitties. Those need to be addressed as soon as they start happening. So.
Okay, what else? What are those other things that we might see?
Yeah, we talked about a little bit about extra water. Cats, without having water, constipation is a big problem in our elderly cats. And then kidney problems start erupting. And that's one of the big 3 diseases that we worry about in cats as they get older: kidney problems, diabetes, and hyperthyroidism. The problem is they all look very similar. So routine blood work, maybe it's every 2 years, maybe it's every 3 years, maybe it's every 6 months, depending on how your kitty's doing.
Okay. What's the longest that you've seen a cat live to?
I've had a patient live out to 22 years.
Wow.
Yeah.
Is that pretty normal? Is that pretty
I wouldn't say that's normal.
Okay.
I always tell people that when you get into the teenage years of kitties, anything can happen. Those big 3 diseases, those tend to start coming into play. And then with underlying diseases, that unfortunately will shorten some of those kitties' lives.
Okay. All right, Dr. Rob, thanks always for coming on. And if you have a cat, think about those things, get them to the vet. All right, thanks so much.
Thank you.
We'll be right back.